I really want to welcome all of you, and I'm very excited to be here. A little bit about me. I've been working in the field now of addiction with coexisting chronic pain conditions for almost 30 years. I've been living with my own chronic pain for almost 32 years, and I've been in recovery from alcohol and pain pills for almost 33 years. It would have been 34, except the first year I tried to do it Steve's way and found out that didn't work real well. So what I'm presenting today is, I believe, the missing link, not just for pain management, but also for addiction treatment, is helping people stop getting in their own way. Now, let me ask you guys a question. How many of you ever have had something really exciting that you wanted to accomplish, and the only reason it didn't happen because you got in your own way? Anybody ever have that happen? Yeah, I call that the inner saboteur, so we're going to talk about that. Now, the first part of my presentation today isn't about the patients, it's about looking at us. And my premise here is, if we're not able to identify this in us, we're not going to be able to help others identify it in themselves. So that's the whole premise of what I like to present. Now, there's a couple of prerequisites for this workshop. One is that we go out there and stop the noise. Another one is, you got to be willing to have some fun and maybe learn something. Does everybody agree with that? Is everybody okay with that? Because it's really important to have fun. And a lot of the people, I don't know about you, but a lot of the people that I've worked with that have come in with debilitating chronic pain are hopeless, helpless, victim mode. They believe their life is over. They never can have any fun. They can never have any relief. They're always suffering. And I've seen that same phenomenon in straight addiction people too. What am I going to do without my drugs? I'm going to suffer. I'm not going to be able to have fun. I'm not going to be able to socialize. I'm not going to be able to sleep. I'm not going to be able to work. All of that phenomenon is going on that needs to be listened to, because in order to create a bond with people, they need to feel like they're listened to, understood, taken seriously, and affirmed as a human being. And so we need to connect with them at that level before we can even think about starting to challenge their resistance and denial. And this is very much a motivational approach. How many of you have had any training in motivational interviewing? Then using that system with this model gives phenomenal results. And this is a very strategic, step-by-step, comes with a manualized treatment approach, which is the workbooks that we developed to go with it. I'm also the clinical director for the Gorski Synapse Corporation, and I've co-authored the latest relapse prevention therapy workbook with Terry. And right now we are about ready to launch the whole new model of relapse prevention next month in Fort Lauderdale in our 5-day relapse certification school. So, I've really been fortunate to be working with him since 1991. He's been an excellent mentor for me. There's been a rocky start, though. When I went to his training in 1991, I was about 10 years in recovery. First day of the workshop, he comes up to me and says, "Steve, do you know you're in the middle of a relapse?" My first reaction was, who the hell does he think he is, And then I listened to him, and it was absolutely true. And relapse happens way before people pick up, drink, or use. And I was probably, if you look at a 12 o'clock position, 11 o'clock's when people use, I was at 5 o'clock. I was well into the cycle. So I've learned a lot from Terry over the years. And then, like any good partnership relationship, back in the early 2000s, I helped him. Because at that point, he was told he needed to have his shoulder replaced. And Terry can be just a touch stubborn, not wanting to, do what's recommended. And he put it off until 2008. So I was doing a lot of pain management coaching with Terry over the years. So it was really nice, to have reciprocal relationships with people. Now, again, having fun is important. I'm going to show you a group of guys that are really into having some fun, and then we'll get into the rest of our regularly scheduled program. If this goes badly, they'll be my patient. You see oh my gosh! What an adrenaline rush! That was a real secret, adrenaline junkie. And that's what got me in. it's a small group, so let's kind of get to know each other. So I want to just, since there's so few of us, we'll just go around, and here's our talking points, okay? To just briefly, who are you? Personally before professionally. We always say what we do rather than who we are. And then, why did you decide to come here this afternoon? What is your personal experience with self-sabotage, resistance, and denial? And most importantly, what do you want to get out of being here in this workshop? So let's just start right up the start.
And you.
Of course. I told you I was going to pick on you, right?
Yes, you did.
I warned you.
My name's Mary Pollock, and I am from Western Pennsylvania,